Hello, this is Dr. Anshu Gupta, MDS, Director of Advanced Dental Care Center, Chandigarh, India. We are the leaders in dental tourism in India and we specialize in dental implants, cosmetic dentistry and orthodontics. For any queries, you can call us at 9855123234. Today in this video, I am going to show you the tooth preparation for the porcelain veneers in the case of minor spaces between the upper front teeth. Here in this video I am going to show you the tooth preparation for porcelain veneers for closure of spaces between the teeth. So as you can all see and appreciate, there are minor gaps between these three teeth which the patient wants to get closed, and we are going to do this porcelain veneers for that. So I am going to take a tapered round 13 number burr and start with the tooth preparations. Just open your mouth, sir. We have to make a chamfer margin 0.5 mm in depth carefully. We have to do a very minimal prep as we just want a finish line for the veneers to be seated. Very gentle and very minimal tooth preparation is required. The preparation of one of the veneers is complete. I have brought the veneer margins here proximally because we want to close the gaps. If the teeth were not having spaces, we will keep the margins buccally. So that is what I wanted to show. Let me complete you the other preparations and show you the final preps, how they look. Seated preps, as you can all see, nicely made and finished. Very thin chamfer margins, neatly and beautifully on all three teeth. Two-stage putty impression. I have loaded the tray with the putty and put a cellophane sheet on the top to make a spacer for the light body to flow in. I have placed the tray in the mouth. When the material sets, I will remove it. So I have removed the impression tray from the mouth and I am going to gently remove this cellophane. As you can all see, we have made a nice spacer here for the light body material to flow. I am now going to load the tray with the light body. Dry the teeth. Open, sir. Open. And you gently place the tray into the mouth. I will show you the impression once I remove it from the mouth. Here is our beautifully made two-stage impression. As you can all see and appreciate, the margins have been transferred very nicely and accurate from mouth to the impression, and I gave little buccal grooves. So for the increased veneer retention, they can also be seen clearly and beautifully here. Now I am going to go ahead and make the temporary veneers till the time the patient comes in for the second visit for the cementation and trial of his final veneers. If I bond on all the three teeth and have cured it, now I am going to fabricate temporary veneers. My all-time favorite is Valex Plus from 3M ESPE for the temporization. I am going to take a dollop of it on the flat-ended plastic instrument. Open, sir, open a little bit. Place it gently onto the tooth. We don't have to do the incremental build-up. We have to do it in one shot so that when we remove the temporary veneer, we can just stick it at one end of the probe or explorer and gently remove it. So here is how I make my temporary veneer. Hold it on, cure it. I am going to cure it. I'll show you all the three temporary veneers after I complete it. You can all see all the three temporary veneers have been made and they are nicely in place. We will keep them on till the time we call the patient for the next visit for the cementation and trial of the permanent veneers. On the model, I will show you the final veneers which we have fabricated for closure of gaps between these incisors. So Here are the veneers that I'm going to place on the model. As you can all see that the gaps have been closed nicely, as you can see and appreciate on the model. Now I'm going to try these veneers in the mouth. Now I'm going to try the final veneers in the mouth. They are fitting nicely and beautifully. The color is quite good. The shade matching is wonderful. The spaces have been taken care of. Sir, are you happy with the way the teeth look?
Yes.
Okay. So I am going to go ahead, remove these veneers and follow the 5-stage cementation technique for the cementation of these veneers onto the teeth, in which we will first apply the etchant gel on the porcelain veneers, followed by the washing and drying of the gel, followed by the application of silane, and then the application of etchant on the tooth, followed by the universal bond, followed by the Variolink veneer luting cement from Evoclar Vivadent for the final cementation of veneers onto the top of the teeth. I have applied the porcelain etch gel on all the veneers. We will leave this gel on for the period of 60 seconds. Then I am going to wash off this gel and then dry it off and then apply this silane. After this application of porcelain etchant gel and silane, we will move on to the patient's mouth and apply etchant and bond onto the tooth surface, and the final luting will be done with the help of this Variolink veneer light cure luting cement from Evoclar Vivadent. I am going to use a transparent shade or a clear shade in this case, as we are not changing the color. These are our prepared porcelain veneers now after the application of the silane. Look how they look from inside after the silane has dried and evaporated on its own. Now I am going to move on to the patient's mouth. I am applying the normal etchant gel onto the tooth surfaces where we have to apply the veneers. I am going to leave this gel for 15 to 20 seconds, then wash it with a gentle stream of water, dry it, and then apply the single bond from 3M. Suction. I have washed the porcelain brush. I have washed the etchant gel. See the frosted surfaces of the tooth after the washing and drying of the gel, and now applying the universal bond from 3M single bond. This is the bond that I am using. I am going to apply it with the micro brush gently, rub the bond tightly into the tooth surface. Yes, see. Now after the application of one application, I am going to gently dry it off. Then I am going to reapply the bond. Again rub it onto the tooth surface. This will make sure that none of the porosities and the surfaces is left without the application of the bonding agent, and it will also minimize the sensitivity in the teeth. Again I am going to dry it, floss. Passing the floss here to see that no excess bond is left anywhere. Now we are going to cure it from the buccal as well as the incisal surface. This is a veneer. I am going to apply this veneer luting agent. And gently stick the veneer onto the surface of the tooth like this. I will press it gently to remove any excess. Use a micro brush to clear off the excess cement. floss the area. Open it a little bit so that no excess cement is there in the proximal wall. I'm going to hold the veneer gently into the place and start curing. We will first do the tag curing of all the veneers to make them seated in a place. Suction. Open, sir, open a little bit. Tag curing, leave it. Done the tag curing. Now I'm going to clean the proximal surface to remove the excess. Alright, and similarly I'm going to place the third veneer in place. Tag curing. And the floss to remove the excess cement from the interproximal area. Alright, now all the veneers have been, just close down sir, have been seated and placed and tag cured. Now I'm going to do the curing of veneers from 5 surfaces: buccal, cervical, incisal, mesial and distal, that is both the proximal surfaces. This is the most important step. We are not to miss the curing of any of the tooth surfaces. That will compromise the bonding of the veneers with the tooth otherwise. Start curing. Now this is how the veneers they are looking after the final cementation. I hope I have made myself clear on the cementation process as well. Open sir. I'm going to remove the retractor. Bite down sir. You feel comfortable? Just rinse your mouth once.